Today we can discuss a mental disorder, depression. So what is depression? Depression is a mood disorder that results in persistent feeling of sadness and loss of interest. It is also known as clinical depression or major depressive disorder. Now we can see what are the symptoms of depression. There will be feelings of sadness or tearfulness. The individual may have feelings of hopelessness or emptiness. There will be lack of pressure in the normal routine activities such as bathing, brushing the teeth, taking the food, etc. Also, the individual will not have any pleasure in hobbies, sports and games. The person will try to remain at home rather than going out and socialize with others. There will be reduced appetite for food. As a result, there will be weight loss. Sometimes there may be increased cravings for food, so there will be weight gain or obesity. Also, the patient will have troubles in concentrating, troubles in thinking, also troubles in making the decisions. There may be psychomotor agitation, that means the individual will have irritability or physical restlessness. Some persons will have psychomotor retardation, that is, there will be slowness of body movements. Also, the person may have slowness of thoughts, slowness of speech. Sometimes the person will hesitate to reply to the answers. They will not reply the answers. Some persons will have monosyllabic speech or monotonous speech. That means the patient will reply words or monosyllables. The person may have negative thoughts, that is, recurrent thoughts of death. They talk about dead persons, they talk about suicide, and sometimes even suicidal attempts will be there. In case of older adults, they complain of worries and aches, memory difficulties, etc. If in case of children, there will be again worries and aches, they will be clinging to the parents. The symptom of refusing to go to school, irritability, that is sudden outbursts or even small matters, irritable or temper tantrums even over small matters can be a symptom of depression. The person may experience insomnia, that is lack of sleep. Sometimes hypersomnia, that means excessive sleep. There may be tiredness or lack of energy. The person will feel tiredness or lack of energy. How we can diagnose depression? If the above symptoms persist for 2 weeks or more, it is known as a minor depressive disorder. If these symptoms persist for 6 months or above, it is known as a major depressive disorder. Now we can see what are the triggering factors for depression. Prolonged hospitalization as a result of major accidents can cause depression in some individuals. Sometimes serious medical illnesses can cause depressive episodes in some persons. The other reasons are loss of a loved ones through death, divorce or separation. Also, abandonment of old age people living in old age homes or living alone. The other factors are personal conflicts either with a spouse or a superior or a significant person in their life. The major life changes like loss of a job, retirement, changes in job can also cause depression in some individuals. In case of children, loss of parents by death, divorce or separation can cause depressive episodes in children. The other factors in children are in the school settings, humiliation by the friends or teachers due to the low academic performance or low performance of extracurricular activities can cause depression in the small children. Depression can also be caused by physical, emotional, or sexual abuse. Now, what are the common medical illnesses which can be associated with depression? Nowadays, COVID, other diseases are epilepsy, stroke, Parkinson's disease, Alzheimer's disease, multiple sclerosis, coronary artery disease, commonly known as heart attack, cancer, thyroid problems such as hypothyroidism, hyperthyroidism, hyperparathyroidism, Addison's disease, Cushing's syndrome, and diabetes mellitus. What is the prevalence of depression in India? India is the 6th most depressed country in the world according to the WHO report. Government estimation is that 1 in 5 people in India need psychological counseling or psychiatric treatment. Studies show that 20 out of 1 lakh people in India suffer from depression and commit suicide due to the depressive episodes. According to some studies, 42.5% of all the corporate employees in India suffer from depression. What are the types of depression? One is peripartum depression. That means some women may experience depressive episodes during pregnancy. Another is postpartum depression. Here, some women may experience depressive episodes for weeks or months after delivery. Yet another type is premenstrual syndrome. Here, some girls or women may experience irritability, anger outbursts, frustration, symptoms of depression like sadness or tearfulness before or during every menstrual periods. There are other types of depression known as bipolar mood disorder. Here, episodes of mania and depression alternate with each other. Another type is cyclothymia. Here, episodes of hypomania alternate with episodes of mild depression. Yet another type is DISTHYMIA. That means symptoms of mild depression only occur. There are other types according to the age of onset. One is childhood depression. Here, the symptoms of depression occurs or begins in childhood. Another is adult onset depression. Here, the symptoms of depression occurs in adolescent period. Yet another type is geriatric depression. Here, the depressive episodes begin or occur in old age. That means more than 65 years of age.